Hey guys, Morgan True, VTDigger's Burlington Bureau Chief. I'm back here in the Media Factory in the studios of WBTV LP 99.3. And today, on this new episode of Dig This, a visual podcast, we have a special guest, Jackie Corbally, Burlington's new opioid policy manager. Hey, Jackie.
Hello.
So I'm just going to dive right in. This is a new job for you, and just tell us about what this position entails.
So this position is a combination of responsibilities. First and foremost, it's a citywide position, meaning that I am working within the city to address the opioid epidemic, housed in the police department. Secondly, I'm heading up an initiative called CommStat, which is a data-driven initiative, which is part of the Chittenden County Opioid Alliance, one of 4 action teams. So in the CommStat model, looking at data to be the driver, and really give us some insight as to what is working and what do we need to improve upon. And then secondly, working within the City of Burlington and looking at the epidemic and really reaching out to Burlingtonians, citizens of Burlington, getting their feedback, and really looking at how we can address this epidemic and provide a clean and safe city for our residents.
Does that get down to a pretty granular level? Like, are you working, if somebody is arrested by Burlington police and it's clear to officers that maybe they're struggling with addiction and not getting the help they need, do you get involved at that level?
I can. And one of the things that I have been doing is, as folks are getting arrested, offering a conversation, talking to folks about treatment options, talking to folks about recovery and what recovery looks like, and then getting them set up with the appropriate treatment place in order to get that assessment to determine that track that they need to engage in if they are so inclined.
And so this is something that you have a great deal of experience with. You've said in the past that this new position feels like a culmination of your work over 3 decades. Can you sort of share the arc that's brought you to this point?
Mm-hmm. So this is not only 3 decades worth of work as a social worker that's brought me to this point, but also personally, I've had family members who have lost the battle of addiction. So for me, as a social worker, all of the positions I've had both here and in the Midwest have had, unfortunately, addiction as part of the work. And so this was an opportunity to bring that experience, both from a nonprofit and a state level, and really help the City of Burlington craft policies to remove and to lessen the epidemic. So it's exciting for me as a social worker to be able to bring all that experience to the table.
You and other people who work in public health frequently talk about opioid addiction as a chronic health problem, a condition like hypertension or diabetes, really a chronic disease. What would you say to people who view drug addiction as a matter of personal choice or even in some cases a moral failing?
If that were the case, I wouldn't be sitting here. Years ago, the federal government and state followed suit that we are dealing with a chronic health condition. Just like you were mentioning diabetes and other chronic health conditions, blood pressure, hypertension, etc. This is a chronic health disease. If it were just as simple as saying no, we wouldn't be in this situation. Addiction is something that not only affects your brain, it affects you personally. It's a horrible, horrible disease. And oftentimes what we notice are that addiction is also tied into a variety, potentially, of mental health illnesses that really you need to look at this from a co-occurring lens. So I wish it were as easy as just saying no, but we know it's not as easy as just saying no. We went through this whole just say no back in the Reagan era. It's not that simple. It is a chronic health disease. We're treating it like a chronic health disease, and we need to look at it like a chronic health disease and make sure that folks have access to services, medication if need be, and that we also look at this not only as an individual health disease, we look at this as a family disease. Anyone who's ever lived or cared or loved somebody who was addicted knows that it ripples through potentially generations and has a huge impact on the family system.
Another thing that we hear a lot about as it relates to opioid addiction specifically is the efficacy of medication-assisted treatment, or the combination of counseling and prescribed medications like buprenorphine, which is commonly called Suboxone, or that's the brand name of a drug, and that's something that prevents withdrawal, provides enough opioids to prevent withdrawal, but does not get the user high. People in recovery may take drugs like buprenorphine for years or even decades as part of getting their lives back on track. What would you say to people, though, who say that, well, isn't that just replacing one addiction with another?
What I would say is that it's not just buprenorphine. It's buprenorphine, it's methadone, it's Vivitrol. We wouldn't be having this conversation if you and I were talking about high blood pressure and I was a physician and I said, Morgan, why don't you take medication? You would take the medication. It's no different when we talk about opiate dependence diagnoses. The medication basically stops the cravings. One of the things that Vermont did back in the early 2000s when methadone came to our state is to say that we're not just going to give medication, we're going to also do counseling. We're going to make that part of the package. Anybody who's in one of the hubs, one of the clinics around the state, is getting counseling in combination with the medication. It is not a moral failing. It basically is giving the medication to stop the cravings while an individual gets their life back together. There are some people who take this medication for the rest of their life. What it offers them is the ability to lead a healthy family life. These individuals are working. They're your brothers, your sisters, your parents. They're holding jobs and they're functioning as part of as part of society. So we are very careful when we talk about medication and how we use it. It is not, you are not going to get high from the medication. It's really blocking the cravings so that you can do the counseling and move on with your life in a successful way.
Burlington Police Chief Brandon Del Pozo announced your hiring at a news conference at City Hall and really brought to the fore the CompStat model, this data-driven approach with partners in the Chittenden County Opioid Alliance. He said the mission is to break this city free from the opioid epidemic, to break it free from the grips of heroin. What might that look like if you guys are successful?
What that looks like are that when you walk down the street, you don't see needles on the street. If you have a dependence and you need treatment, that you're getting treatment within 24 hours. You're not being placed on a wait list to get those services. It's treatment without delay. If you're a family who's struggling with the impact of an addictive individual in your family, you're able to get those services. That we are having healthy conversations in our community around addiction, both from a treatment and recovery lens, but also from a prevention lens. And that when kids and young people move forward and they're faced with making those choices, they have information to understand where those choices can lead them. When you are a family member and you have a family member who's suffering with this horrible disease, you have options, you have places to go where you can talk. So it really means communication, it means health, it means safety, and it means treatment without delay.
Can you talk about two of those aspects? The first is safety. It's obvious to a lot of folks because, we see it and we often hear the police talk about how addiction is tied to things like property crime and stuff like that. But how is sort of curbing this epidemic going to make people safer?
If you're doing a good job, and this is what CompStat will tell us, our retail thefts will decrease. Our car break-ins will decrease. Our home burglaries will decrease because those individuals that are doing those behaviors are feeding an addiction. If you're getting treatment and you're able to access jobs and you have housing, then the goal is that you won't need to do those behaviors in order to feed that addiction. So people will feel safe in their homes and feel that this is a community where they can raise their family and not have to worry about those unsafe behaviors that folks are doing. The other piece is that we want to make this really a less desirable place for folks who are dealing these horrific drugs to come to. If they enter the city of Burlington, they need to know the police are going to respond. They need to know that legally folks are going to respond with everything they have. The goal is to make this a place where if you're thinking of coming to this community and dealing substances, you are not welcome. And you will feel that not only with the police presence, but by your community presence.
And I guess presumably, if you guys are successful, this will also reduce the number of overdose deaths, which,
Yes.
are consistently rising year over year here in Vermont and in Burlington.
Yes. If we're successful, and I really do believe we're going to be successful, we have a community who is engaged and getting more engaged as we move along. Absolutely. That we will really cease and really reduce the overdoses that we are experiencing. That is one of the most horrific things that you have when you talk about a heroin epidemic, are the loss of life that we are experiencing. So we will know that we have gotten to that plateau that we're shooting for when we no longer experience overdose due to this horrific substance.
And just one final question, just on the treatment on demand, finding slots in treatment programs for people when they're ready to seek that help. That's been an elusive thing for Chittenden County, especially Chittenden County, other parts of the state to a lesser extent, but that's been a real challenge here. You worked in the Chittenden Clinic in South Burlington. You know this. You've seen it on the front lines. What's it going to take to get to treatment on demand?
I think it's potentially we need to look at access. We need to look at, once the St. Albans Clinic opens, how is that going to reduce our wait list numbers for medication-assisted treatment? It's a couple of things that we need to look at. One, do we need to open up more hub slots? Do we need another clinic? Do we need to expand the clinic we have? We also need to look at our physicians, our spoke doctors. What do we need to do to bring more physicians to the table? What do we need to do for the physicians to feel comfortable prescribing? So it's not as simple as just saying, let's just, open another clinic. There's a number of variables that are happening here. And I think the combination of Franklin County opening their clinic, looking at our wait list, looking at, do we need to have another facility? Do we need to expand? And let's get more physicians on board to prescribe the medication, Suboxone, as you refer to.
Yeah, okay. And for folks listening or watching, the hubs are the larger clinics that can treat hundreds of patients with either Suboxone or methadone. And the spokes are individual physician practices, doctors around the state who are doing addiction medicine in a primary care setting in a doctor's office. Jackie Corbally, thank you so much for coming in. I'm Morgan True signing out from the Media Factory. Check us out, dig this, more Vermont news at VTDigger.org. We got you guys covered. Thanks a lot for tuning in.